Penninsula Behavioral Health is a licensed mental health and certified chemical dependency treatment organization. We provide a range of psychiatric and psychological services to children, families, individual adults, and senior citizens throughout East Clallam County. It is our experience that healing the individual benefits the entire community.
2012 marks our 41st year of providing behavioral health services to residents here in Clallam County. We have outpatient offices in Port Angeles and Sequim, as well as a day treatment program and 6 residential facilities. Many factors contribute to the growing mental health needs of our community. In the last 3 years, we have expanded our client census by 33% and developed several new treatment programs in response to the changing needs of our county. Today, we serve over 3,000 clients through a variety of outpatient and residential programs. They include crisis intervention and stabilization, community support services, psychosocial rehabilitation and day treatment services for persons with severe mental illness, residential treatment and supportive housing, treatment of co-occurring disorders, and individual, family, and group counseling for both children and adults. In addition, we provide specialized services for persons with developmental disabilities, an intensive treatment program for juveniles in the court system, and counseling programs for veterans. Peninsula Behavioral Health's clinical staff of mental health and chemical dependency licensed psychiatric professionals consists of MDs, advanced registered nurse practitioners, social workers, counselors, registered nurses, and case managers. They use a variety of treatment approaches to work with individuals and groups. Our outpatient services include adult and older adult counseling, developmental disability services, veterans program, chemical dependency treatment, domestic violence program, as well as extensive services for children including individual, group, and family therapy, consultation to schools, Project Safe Care, Credible Years Parenting Program, Behavioral Health Team for juveniles in the court system, and Family Preservation Services.
The Incredible Years program. It's a fun, interactive 18-week program for parents of children from birth until 8 years of age. Parents learn to promote positive behaviors with their child, build social skills using effective praise, and reduce inappropriate behaviors and support their child's education. Programs such as this one are an essential part of preventive care, which benefits the entire community.
When a mental health organization is able to increase outpatient services to the residents of a community, there is often a significant reduction in the need for crisis services. There is a decreased cost and a corresponding benefit to other community resources, such as the hospital emergency room, jail, police, and sheriff's departments. We provide a safe environment for individuals who might otherwise overstress other agencies.
In the last 3 years, PBH has expanded its medical staff. PBH employs a part-time psychiatrist and 3 full-time psychiatric nurse practitioners, all certified at the highest level.
Staff training is an essential part of our center, as is the employee assistance program we offer at PBH. Our staff encounters difficult situations on a daily basis, and they must be carefully trained to guide distressed individuals through our system. We're proud of the professional level of our staff, and we highly value their input in the daily running of programs, sessions, and workshops.
A patient whom we'll call John was a 2-tour Iraq veteran struggling with debilitating symptoms of post-traumatic stress disorder and a traumatic brain injury. These difficulties were related to multiple combat and roadside bomb exposures and compounded by the deaths of several of his friends in his unit.
I had been a patient at Penninsula Behavioral Health for over 15 years.
John's issues were not caught during the discharge process, which played a significant role in his subsequent divorce and homelessness within the following 6 months.
Obtaining a correct diagnosis and the appropriate treatment was essential to my recovery, as was having access to a crisis bed at the Arlene Engel Home and the social support of the Horizon Center day program.
John came to the attention of our Veterans Counseling Program through a local Vietnam veteran. Over the course of 20 months of counseling and the utilization of collateral support from other veterans' resources, he was able to make good progress with post-traumatic stress disorder and traumatic brain injury symptom management. This allowed John to grieve his losses, reconnect with his strengths and resiliency, establish supportive housing, re-establish contact with family and friends, and enroll in a VA vocational rehabilitation program.
After managing well for a number of years, I was able to eventually transition my care to the VA because I am a veteran.
Though not symptom-free at this point, John has been able to better manage his mental and physical health issues. He has enhanced the quality of his life since he's walked through our doors. Today, Peninsula Behavioral Health works with Serenity House of Clallam County to operate Maloney Heights, a 28-unit apartment house for formerly homeless people. 8 of the apartments are for use by veterans. To provide these vital programs and services, to maintain our staffing, and to keep our facility modern and safe, we need a budget of approximately $5.6 million a year. Part of that budget comes from the state and federal funds. Unfortunately, those funds have been shrinking every year. To close the budget gap, we must seek grant funding and fundraise for the remaining needs. United Way, a supporter of our mission and objectives, is just one of our grant funders. We are now seeking private and corporate funds to establish a much-needed crisis stabilization unit, a first response group vitally needed in our community.
An essential role of a community mental health center is to increase awareness of mental health care and reduce the stigma around those seeking help for mental health problems. Through bringing the programs to the community and emphasizing the preventative care programs, Peninsula Behavioral Health can gain a deeper understanding of individual needs and achieve a healthier environment.